Hi, I'm Jeff Raymond, a medical writer with the Oklahoman, and I'm here today with Dr. Ted Bader, a gastroenterologist with the Veterans Administration in Oklahoma City and the OU Health Sciences Center, and Melvin Bourgeois, an Oklahoma City resident, and we're going to be talking about hepatitis C research. And Dr. Bader, I understand you have a paper appearing online tomorrow in which journal is it?
The American Journal of Gastroenterology. We are publishing an original investigation that for the first time shows an FDA-approved drug, now this is for some other indication for lowering cholesterol, but that this FDA-approved drug has significant inhibition against hepatitis C virus in human beings. What we showed is in 31 veterans, if they took fluvastatin by itself every day, about half of them had a significant reduction of virus that lasted anywhere from 2 to 6 weeks. This is important because there has never been a drug outside the interferon class or ribavirin class shown to lower the virus in human beings' bloodstream. And we think we have not proven that adding this drug to standard therapy will increase the cure rate, but we believe that's the case. I'd like to emphasize that taking fluvastatin by itself will not cure anybody of hepatitis C. But we are currently in a phase 2 trial where we're adding fluvastatin to interferon and ribavirin, hoping that we can prove that the cure rate will be improved.
So can you explain what fluvastatin is normally prescribed for?
It's used to lower cholesterol. This particular drug is still under patent, but in a year or two it may be generic. Now, the significance of our findings is that if this bears out that we do improve the cure rate, this will by far be the soonest thing available to improve therapy for hepatitis C compared to anything else worldwide in research and development. I want to emphasize that fluvastatin is not approved by the FDA for treatment of hepatitis C, but that it has been approved for 15 years for lowering cholesterol, and millions of people have taken it, and we know there's not major side effects from it.
So what led you to believe that fluvastatin could be useful in treating hepatitis patients?
I was intrigued. There was a Japanese study, a test tube study, showing that statins had activity against a hybrid type of hepatitis C virus in a test tube. That intrigued me because it was a drug that was readily available to me. And there's been very little on the last 7 years happen in this field. Since the pegylation of interferon in 2001, there's been there has been no new drug for this. And so since it was available to me, I went to the FDA and got the proper license, and very pleasingly showed that it had some activity.
I'm wondering if you could tell me, Melvin, about your story regarding hepatitis, how you contracted the disease.
Hepatitis for me began with a wound received in Vietnam. I was a Marine in Vietnam and received shrapnel from an IED that severed my liver and required me to have blood transfusions back in 1968, and which I recovered from, not knowing that I had hepatitis C though. Years later, I always felt a want, or even a responsibility to give blood, and when I decided to do so in the late 80s, early 90s, the Red Cross determined that I had hepatitis C.
And this was something you had no...
I had no idea. I had no idea that I had hepatitis C. I followed up with my local doctor, retested, and it was confirmed, and sought treatment back then in the early 90s. The first treatment was only simply interferon, lowered the virus load, but never did cure me. A few years later, ribavirin was added. I gave it an attempt, but could not stand the treatment.
As you were telling me earlier, it was pretty rough.
It was pretty rough. So I decided as soon as I reached retirement age, I did retire and took on the task of going through the treatment program. When I did so through the VA, both drugs, interferon and ribavirin, had been greatly improved. And it was a 48-week treatment. I was successful. I cleared early in the program, 12 weeks.
Clearing meaning?
I had no detection of the hepatitis C virus.
So it was pretty much gone?
Pretty much gone, and tested again 6 months into the program. I kept taking the medication and tested at the 48-week completion, still gone. Tested 6 months later, still gone. Still no trace, no detection. 1 year later, still none. And then coming this July, I'll be tested again.
So you've gone how many years without any detectable?
Let's see, this will be my 3rd year.
So does this show that curing hepatitis C is achievable?
Yes. John has achieved a cure of his hepatitis C. We know that because of the first interferon trials in the 1980s, where the virus was undetectable in the bloodstream after interferon treatment. Those patients have remained viral negative in the bloodstream for 25 years. We don't normally do liver biopsies looking for the virus, but when those have been done in the National Institutes of Health patients, they don't show any virus in the liver biopsy. And more importantly, the liver biopsies return to normal, and we can't find any trace of the virus. And this is 25-year follow-up. And so the experts in this field feel like this is a legitimate cure.
Very pleased to hear that there are some promising advances in hepatitis C research. Thank you very much for talking to me.
Thank you, Jeff.
Thank you.
Thank you.